Welcome to the Mind Meets Medicine podcast, where we believe the future of healthcare is mind meeting medicine. Hi, I'm Kaila, a licensed therapist and founder of a mental health care clinic.
And I'm Dr. Sir, a board-certified psychiatrist.
Together, we will join the fields of medicine and psychology to provide education, elevate guest perspectives, and foster curious, informed conversations. Welcome to episode 1 of Mind Meets Medicine. I'm your co-host, Kaila.
And I'm Dr. Sir.
And we are going to dive right in today with some introductions and what to expect from this podcast.
Yeah, perfect.
So let's start with a little bit about Dr. Sir. If you could give us a overview of who you are, and then we'll switch.
Yeah, for sure. Big picture, I'm originally from Texas. So I grew up there just outside of Dallas. And then just from a professional standpoint, I did my undergrad at Dartmouth and then did medical school at Vanderbilt. And then came to the West Coast for the first time for psychiatry training to do my psychiatry residency at UCLA, which is 4 years long. And there, so I got a pretty wide range of clinical experiences. So I've worked in locked inpatient units where people aren't allowed to leave, where we do both voluntary and involuntary treatment. Mostly medications, but there are also people for more interventions like electroconvulsive therapy as well, ECT. And then I worked in academic settings, private settings. I worked in the county hospital in the emergency room and in county clinics. I've also worked in jail diversion programs. And then here in the Bay Area, I've worked at a pretty large county hospital doing consultations. So people with mental health issues that aren't actually in the mental health hospital, they're in the medical hospital, so complicated medical and psychiatric presentations. And then that was a few years ago now. I'm now a board-certified psychiatrist practicing in the Bay Area.
Bay Area transplant.
Yes, transplant. And I have a private practice. I'm pretty general psychiatrist. One of my niches is OCD, or obsessive compulsive disorder, and anxiety disorders, but I pretty much see a bunch of stuff. And then I also teach. I teach primary care residents about how to practice mental health in the community.
Nice.
Yeah. All right, Kaila, tell us about you and your experience.
All right. Well, I'm Kaila Haddis. I am a marriage and family therapist. I started out really working with teenagers and children, and over time have transitioned to working with families and just adults and couples. And my real passion is working with parents and doing parent work as an offshoot of couples therapy. And I also own a group practice. If someone is unfamiliar with what a group practice is, it's kind of a mental health clinic. And I have therapists who I work with, and we all kind of get to work in this private practice setting, but under one umbrella of a business. And so it's really nice that I get to have this come to work and put on trainings and be able to advance clinician knowledge and support and education while also still carrying a caseload myself as well. Yeah. And so I'm originally from Santa Cruz, California, and I bopped around California a little bit, never left the state, but I moved back to Santa Cruz in 2015, and one of the things that brought me back there was that my dad was sick, and so I got to be able to be with him in the last few years of his life while also getting to work in the town that I was born and raised in. And now having a really busy mental health practice in Santa Cruz, and It is also over in San Jose as well, but being able to serve the community there where I grew up is really special to me. Yeah. It's nice to know all of the background because we both bring kind of a wide variety of clinical experience, and having worked in lots of these settings allows us to also be able to speak to some of the more systemic interworkings of the field.
Yeah, and also probably helpful to know, even as a trainee in residency before becoming an attending, we were probably seeing maybe 300 patients on the low end per year to 600 or 700, depending on the year of the rotations. So by the time training was done, I've seen in the probably low 2000s, maybe 3000 patients before, or patient encounters. And so there's like, it's a very broad experience with a high volume.
Mm-hmm. Yeah.
So I think part of kind of where we meet is me seeing a large volume of people over a wide range of disorders and interacting more medically, even though I do have some therapy in my practice as well. And you bring that kind of deeper psychological perspective and emotional perspective. And that's kind of part of what we're trying to do, is bring those together as a way to educate and also be a resource.
Yeah. I think that's something that you and I have talked about, is, and why we wanted to do this is because there's if you're working in the field, there's maybe an unspoken, maybe sometimes spoken understanding that there's these silos of the field, and there's medicine and there's the clinicians, and there's not a ton of overlap in private practice setting and an outpatient setting. It's hard to find the multidisciplinary care that we're really striving for, and how to build a team around a patient to get the best outcomes. And both of us being in our own respective fields, working in education, there's an ability for us to bring together this blending or joining of the mind and the medicine, the psychology and the clinical lens with the medical lens and the science perspectives.
Yeah, yeah. I even reflect on my training experience in Los Angeles and being in so many different settings and not really having much communication or relationship with therapists. Kind of in the inpatient setting, as far as discharge planning or gathering information, there was that. But in the outpatient clinic, our volume was so high. Yeah, there just really wasn't, I'm trying to remember, there wasn't much interaction that I had with therapists until I entered private practice. And there's, it's interesting. In outside of the larger system, there's even more space and room and maybe intention around trying to coordinate together on the behalf of the patient. And so it's really in the last few years being in private practice that our relationship has grown. And that part of what we want to do is to demonstrate how the fields could work together as well.
Yeah. Why did we want to start this podcast?
Well, I think both of us spend a lot of time listening to podcasts, and some recreational, some professional. And I think that it felt a little bit of a newer, fresher take to have a show not just with a therapist or therapists, and not just with a psychiatrist or psychiatrists, but but bringing together both the medical perspective and the therapeutic psychological perspective, in order to, like, for ourselves, learn where the fields don't align well and where they do, and also to figure out and explore together how we can improve, like, the understanding of healthcare and understanding of mental health by joining our perspectives together.
Yeah. So I'll add to that with
Mm-hmm.
both of us, we would have these conversations about the podcast that we were listening to. And I listened to podcasts with therapists, and you listened to podcasts with doctors. And having a podcast that has the blending of these things and the ability for us to be able to have this reach together also might be a model for other people to hear the perspective of a therapist if you're a doctor, or if you're in the medical model or medical system, and or training to be in the medical system. And if you're in therapy school, or if you're a therapist or a clinician, and or even just somebody listening and you're curious about psychiatry and the more of the medical side of this field, it can be pretty intimidating to even turn on, I think, a podcast run by doctors, a podcast where maybe you don't understand quite everything. And so I think some of our goal in this too is making it as digestible as possible so that really anybody could listen, but anybody who's curious about this field.
Mm-hmm. Mm-hmm. Yeah. I think about some of the medical focused ones I listen to, and there's like 8 years of knowledge needed to understand the jargon discussed. And so I think, part of it is translating what we know in practice is evidence-based, appropriate, safe care, maybe even some cutting edge treatment, but doing so in a way that not just doctors could understand. And maybe even more importantly, I know that in the medical field, we know that therapy is effective. In fact, in many disorders, therapy is more effective than medication alone. But I haven't seen as much about how to work together and collaborate in someone's therapeutic process as the medical provider, or as the medical doctor. And so part of this relationship in this podcast is also kind of modeling, as we're learning together to talk about these issues from the mind and from the medicine. We hope that will also be a learning for the listener as well, as to how they join and how the professionals can work together.
And maybe even shifting the field a little bit so that it is more of a norm that we have this kind of collaboration in these discussions.
Mm-hmm, mm-hmm, mm-hmm.
So one of the reasons that I'm so passionate about education and offering a place where clinicians can come and learn and grow and be a part of something bigger is because as a young therapist myself, I was so hungry for the information. And it was when I was coming up, it was a little bit before podcasts were a really big thing. And it's a lot to know where to look and where to find the information. Personally, I really appreciate long format dialogue and not necessarily having to go hunt for the information, but really listening to experts in their field, people that I could emulate and learn from and really respect, and knowing that there's people out there that want to make it, it's okay to learn and it's okay to ask questions. I remember being in grad school and sometimes being scared to, not know something and thinking that I already needed to be aware of some of the nuances. Now being more than a decade into the field, now I love asking questions, but I don't feel the imposter syndrome when I do. And you're never done learning. There's never an end to what you could know being a therapist. And so, in starting some kind of educational platform, podcast, resources, which is something that we want to provide, and platforming voices that we have already vetted, and we know that they have a leading expertise if they're coming on our show, that it's a place where we all get to learn.
Mm-hmm, mm-hmm. Yeah, I think that life is moving so fast and the fields are moving so fast that it was really important for me to engage with podcasts to help stay on top of stuff when I'm on the commute, especially when I was living in LA, taking an hour to drive 10 miles. It really contributed to being educationally well-rounded. And so I think we both have a desire to be a part of the professional discourse and to help contribute to the knowledge base and the way that people are taking in information. And so that's why we're doing video and audio. In order to do a good thing and put out information that people can trust.
Yeah. And it's okay to be curious and ask questions and not have all the answers.
Mm-hmm.
And
Mm-hmm.
we are going to try our very best to stay as factual and evidence-based, science-backed as possible.
Mm-hmm. Mm-hmm.
And that's a commitment that Sarah and I are both making. And we are very excited for what's to come.
Mm-hmm. Mm-hmm. And you'll get to see how we think about things, which is not something you really get from being in therapy or being in a medical consultation. Yeah, that we hope that you'll get a bit of a flavor of that and also understand a little bit more about the inner workings inside your clinicians, as well as inside the system.
Let's go.
Love it.
So I do think it's important to mention that we are based in California in the United States. We are based in the Silicon Valley Bay Area. And if we are getting into license information, if we are getting into questions about the field, we are probably going to be speaking about what we know geographically here in the United States and in California and what that means to be licensed here. However, if there are questions or things that we can support with, if there's listeners outside of this area, still feel free to listen and write in with questions, and we'll do our best to answer.
Yeah. I think both of our licenses are regulated by state. So, and I haven't had a license outside of California so far. So as much, we will try to be objective and universal as much as possible. But yeah, it obviously will be our information, understanding, and knowledge will at times be because of where we practice, where we live, and who we see.
Yeah. All right.
Which is still maybe useful, but maybe not what we say in medicine, generalizable.
Generalizable. Yeah. Which leads us into also another expectation for the podcast is that we do have guests that will come on, and our hope is to champion and platform other professionals in the field.
Yeah, definitely. Because there are things that we know really well, and there are things that we are competent in, but certainly not experts in. And so we want to bring in people to round that out, not necessarily just to also to interview them, because that's fun to get to know who they are, but also to expand our knowledge base and your understanding as the listener.
Yeah. And if there's anything that people are wanting to see or hear, please go to our website and write in and let us know, because we also probably want to know about that too. So mindmeetsmedicine.com. And if you can like and subscribe, we offer video and audio. You can find us on YouTube and anywhere you listen to podcasts.
Yeah, yeah. As we get going, we'll definitely have a lot more educational resources on the website. So definitely stay tuned in for that.